Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today, the topic of my discussion is about occlusive retinal vasculitis. This is a case shared to us by Dr. Abdul Salam Diab, consultant medical retinal uveitis in King Saud University. Let's have a look. So this is first furnace photograph. Here you can see the hemorrhages throughout the retina. And you can also see at number 1 location there are some vasculitis element over there, how there are occluded vessels over there in the number 1 section. Then even in the number 2 it has also been shown. The hemorrhages are in the temporal areas, and if you see very closely, these vessels are not crossing the mid periphery even in the temporal side. And there are extensive hemorrhages over there, even in the macula. So this is the fundus fluorescein angiography of the patient. Here you can see early stages. There is blocked hemorrhages, fluorescence in the macular area, even in the temporal areas, you can see. And if you observe the fluorescein, it is not going into the peripheral. It is just going up to the macular area and even up to the mid-periphery, especially if we talk about the temporal side. So this is a very classical representation shown in the fundus fluorescein angiography. Here you can see the blood vessels taking up the fluorescein. But if you see at the temporal side, you don't see the blood vessels over there. Those blood vessels have been occlusive, because of the element of vasculitis, especially even they are in the mid-periphery, they are not crossing central area temporally. So, but if you see at the nasal side periphery, there you can also see some leakage. There's another fundus fluorescein angiography section. Here again you can see temporally the occluded blood vessels, absence of fluorescein, and no dye can be appreciated over there. And in this, even in the inferior temporal, you will see some areas infratemporal which are now showing the leaking of the dye. This is another advanced stage of FFA. Here you can see extensive leakage occurring over there, nasally, supratemporally, even nasally, and supranasally and inferiorly, the dye is now leaking up from there, and the hemorrhages there are showing the blocked fluorescence. Yes. This section, the photographer even has taken the inferior sections. You can see the leakage of the dye even inferiorly. The fragile, the inflamed blood vessels are now leaking. And even if you consider the vasculitis element, even inferiorly, it is not going into the periphery. Nasally, if you see intranasally, the occlusion of the vessels are not just beyond mid-periphery, you are not going to see any fluorescein in the vessels. So those are also occluded vessels. Especially the nasal section, the photographer has shown you. And here, very clearly, he has demarcated how there is a demarcation area you can see. I will say demarcation area, where is the non-perfused and perfused area of the retina, where the blood vessels are and where there are no blood vessels. It's a very classical signs of occlusive vasculitis in retina. This stage, extensive leaking, taking up all over there, and all sections later on it is taking up, showing all the areas the dye is going into the retina. These vessels inflamed, and they cannot hold now dye, and it is now leaking into the retina. Hyperfluorescence. But surprisingly, you see that there is no macular edema and no intraretinal, no subretinal fluid, and the macula is dry in the left eye. So let's come towards the right eye fundus photograph. Here you cannot see anything except the hemorrhage All around there is the hemorrhage occupying the vitreous, and you cannot see anything over there. So this is the fundus photograph of the right eye. B scan to see the retinal integrity, any detachment, any traction, anything. So here it is clearly shown that vitreous opacities you can see, but the retina is flat, no detachment element, no traction, nothing like that. But vitreous haze and opacities you can see over there. This patient presented to our emergency, and after his thorough examination, the element of vasculitis was there, as I showed you earlier. These are something investigations which were carried out. His PPD, which is our protocol for tuberculosis, 48 hours and 72 hours, negative. Syphilis was also negative, and HIV was negative. But in the chest, CT scan was done in our hospital, and there we found some patches in anterior posterior section, especially apical. So this is about that. So after that, thorough investigations, blood works, lab works, and FFA plan was done to go for the pars plana vitrectomy in this middle-aged guy. So pars plana vitrectomy was done along with excision of fibrovascular tissue, although it was not causing that much traction, shown on the B scan, and endo laser was done, indirect also used, and after that, even the left eye, which is the ischemic one, that one ischemic areas were also doing scatter lasers over there. The retinal vasculitis is basically an inflammatory disease which affects retinal arterioles, arteries, venules, and or capillaries, and they may have extensive ocular and systemic associations. There are a number of reasons and causes for this. Early stages, you will see over there perivascular sheathing, cuffing over there, cuffing of the vessels over there, and some exudation you can see over there, occlusion, and the capillary non-perfusion, capillary dropouts, especially as I show you in the left eye. This is not that much advanced yet. So these are the elements over there, new vascularization occurs. But the other one, the right eye, is the advanced one, going into the advanced stages where these new vascularized blood vessels, new vessels, they start leaking. The blood comes over there, retinal hemorrhages, and these retinal hemorrhages as a source of promote the fibrovascular traction. This can lead to the tractional retinal detachment. Tractional retinal detachment, once over there occurs, it goes towards further complications, and these patients also develop new vascular glaucoma. So all things like that. So these are early and late stages of this vasculitis disease. This is a beautiful schematic diagram which shows us the molecular level, the genetic pathways of this whole disease, the pathogenesis. So there are basically two factors, pathways, exogenous and endogenous. Endogenous, when we talk about, they may be interreceptor binding photoreceptors proteins, S antigens, heat shock proteins, post-infections. And if we talk about the exogenous factors, there are multiple infections, radiations, all these. And all these factors, which I will discuss and explain in detail, shown in this diagram beautifully, ultimately lead to B cell activation. And after the activation of the B cells, the tissue damage happens. So this was a very beautiful schematic diagram showing the genotype and phenotype of the vasculitis in the retina. So this slide is basically the explanation of the previous one. Here it is shown and mentioned that the exogenous factors, basically such as foreign antigens, infectious agents, they lead to their process by antigen specific protein cells, which results ultimately in B cell activation. If we talk about the endogenous elements such as retinal S antigens or IRBP proteins, all these things, they also lead to the stimulation and cytokine release. So these two mechanisms go on, exogenous and endogenous. Both these mechanisms are controlled by genetic factors. We talked a lot about these gene therapy and all these things in our videos. So gene therapy and genetics is basically the root cause where all these things are starting up. So resultant cytokines which are released and antigen antibody complexes result into the tissue damage, endothelial blood vessels damage. These inflammatory things lead to it. And this is the hallmark of the retinal vasculitis. So this diagram and explanation is wonderful, which I have taken from literature, and I will show you the reference at the end, inshallah. So there are a number of causes for vasculitis if we talk about. Let's start from the infectious. Infectious causes be bacterial, they may be endophthalmitis, syphilis, tuberculosis, acquired immunodeficiency disease, acute retinal necrosis, cytomegalovirus, retinitis. Talk about the non-infectious causes. There are many causes like sarcoidosis. We can talk about the systemic inflammatory diseases, Behçet's disease, multiple sclerosis, Sjogren's, polymyositis, rheumatoid arthritis, leukemia, lymphomas, multiple causes for the non-infectious causes. These two broad categories I have taken. Apart from this, there are a number of ocular and systemic causes which also lead to and contribute to the vasculitis in the retina. So coming towards the end and how we manage this patient was managed by our medical retina and uveitis team. As I mentioned, right eye vitrectomy was done, lasers was done, and to clear up the media. And in the left eye, in all the ischemic areas, they did the lasers over there in the peripheries. I'm sorry, I could not provide you the laser photographs of this patient. But the purpose of applying the laser to the ischemic retina is that wherever there is ischemia in retina, there is vascular endothelial growth factor production. And these growth factors lead to new vascularization. And new vascularization leads to all the hemorrhages, leaking, exudates, ultimately detachment. So we did in the left eye, the peripheral scattered lasers. This was the treatment of the eye which was done. But as this patient belonged to the Indian subcontinent and there is endemic area for this high endemic area for the tuberculosis, so this patient was also managed on the lines of intraocular tuberculosis. So we started him on the prophylactic dose of the anti-tuberculous medication. He was given pyrazinamide and isoniazid dosage, and the main thing after that was that he was also put on the oral corticosteroids, because these are the inflamed blood vessels. They need something to control the inflammation. So under the cover of the prophylaxis of anti-tuberculous drugs, only two drugs were given, pyrazinamide and isoniazid. This were given over the oral corticosteroids to control the inflammation. And this was the treatment of the systemic from site. And if I talk to you about the literature review, I find this article. You can find it on the internet, a comprehensive update on retinal vasculitis and etiologies, manifestations, and treatments by Dr. Agarwal, and published in 2022, Journal of Clinical Medicine. Very informative. They have discussed the different categories causing the vasculitis, and the photograph I showed you over there also taken from that article. I want to thank my respected audience for their attention and attendance. Thank you.